My name is Danelle Serrano. Imagine that you're told that you have less than 6 months to live due to a terminal illness. At that point, what goes through your mind? Is it the fact that you haven't said things to certain people? You've missed opportunities? What are you feeling? Are you scared? Are you nervous? Are you upset? Are you mad? Is it that you're worried about being hooked up to machines, what your quality of life is going to be? This is a very real scenario that many people every day have to face. And with the Death with Dignity law, they would have the opportunity to get physician's aid in dying due to medications. I'm very interested in the medical field and decided to research this topic a lot more because of all the factors that go into it and the big debate on pro versus con, and taking care of the patients and taking care of the families and taking care of the doctors that have to give out these medications. And there is a law in place right now, and I think that Nevada should be for physician-assisted death, which is also called the Death with Dignity law. First, I want to tell you guys about why this is such a big issue. This is such a big issue because patients have so much that they go through when they're told that they have a terminal illness. They have no law to be able to help them, so if they were to make the decision to do it on their own, to not be hooked up to machines, to not get the treatment that they need in order to prolong their life just a few more days, a few more weeks, a few more months, they have to make the decision to do it themselves and quit everything, which would cause so much pain and so much suffering and even so much stress. And the downside of possibly doing that is the fact that they either don't get to say goodbye to their families, so they wouldn't get that closure, and their families may wonder, why didn't they tell me? I didn't know, and that causes them even more grief. Or they tell their family and they run the risk of one of their family members not being able to have that on their conscience. So now they get told that they can't do that. So they end up in a hospital where they have to go through treatment or have to be monitored for suicide. It's also a lot of pain and a lot of suffering that they have to go through, which is the worst part. And to not be able to have quality of life, to not be able to experience things with their family in these last few days. They also have to have so much money put into it. Even if you have insurance, it still can go up to $100,000, which is so stressful on them. It's stressful on their families because once they pass, their families have to carry on with that financial burden. On the doctor's side, they need protection from helping someone to commit suicide, but doing it in a more humane manner. At this point, everyone's biggest objection with the doctors helping them out is the fact that they took an oath, and with that oath, they are supposed to protect, and they're supposed to save people from doing things like that. But in this instance, it would be in their best interest to be protected, to not have to worry about being sued for malpractice, anything like that. It would be in their best interest to be able to help the patient and to be able to respect the patient's wishes. According to Lonnie Shavelson, who is head of the End of Life Options medical doctor, she said it best, that we're always telling the patients if they're right. We're always having to go by what the patient says. They're right, and we have to go with what they say. But when it becomes the end of life option, we have to tell them that they're wrong, which makes absolutely no sense. So now I want to tell you how we should solve this problem. They have the Death with Dignity law right now in Oregon, California just recently passed, Vermont, Montana by a court ruling, and Washington. And what that law is it protects the doctors and the patients who want to have access to these types of drugs. And they take this lethal combination of medication when they're ready to end their life. And they can do it at home, they can do it at the hospital, they can do it where they choose to. But generally most people choose to do it at home. According to the Oregon Public Health Division, they have 1,545 people that have already accessed the drugs since the law became available in 1997, and 991 people have used the medications to end their life. The others have died from the terminal illness. I think that according to the requirements that they have, which are you have to be 18 or older, you have to be mentally competent, you can make your own decisions, you have to prove that you live in that state, which is why it's so important for Nevada to pass this law, that we need to have practicing psychiatrists, practicing psychologists that want to get into the field, that they should be there for the family. So then that way the family is getting counseling as well, and they don't have to worry about paying for it. And the doctors on that, the doctors that are going to school get the practice that they need. So all in all, it benefits everyone. And it's very much more cost effective for the entire state. Now I want to tell you why it works. It's worked in all the other states so far, and according to the Gallup poll, which was recently published in May of this year, 68% of Americans all believe that they should have the opportunity to access these lethal medications and to have access to this law if the situation ever arises for them. Most families are fighting for it right now that have seen their family members go through terminal illnesses, and that's why it's very important that we help end the pain and the suffering and help the family to make sure that they get what they can, the time-wise, and the patient gets what they need. According to Ethan Rummel, he just recently had passed away due to his terminal illness, but he had access, and he said that it gave him more relief because he had another option if the pain got too bad. In conclusion, it's very important to let the patient decide and to give that patient the utmost control in this type of situation. At this point, they're in such a scary circumstance. They don't have much control, but we can give them the control to help out with the financial burden that they're going to face, to help out with the pain and the suffering, and to support their families in this grieving time.